So let us discuss why skin grafts tend to hyperpigment in the postoperative period. So there are a couple of reasons as to why skin grafts tend to hyperpigment. First of all, the melanocytes are injured during the process of skin grafting, and because of the injury to the melanocytes, they get activated and produce increased amount of melanin. Secondly, after the surgery, there is a process of re-innervation which happens, as we all know, and this process of re-innervation leads to again abnormal melanocyte stimulation and again increased production of melanin. Then most importantly, what happens is, especially for skin grafts over the face, the ultraviolet radiation can or possibly exacerbate hyperpigmentation by melanocyte stimulations. That is the reason why we tell the patients not to go in the sun, avoid sun exposure, use sunscreens or use some protective garments to avoid sun exposure. So exposure to ultraviolet rays is also one of the reasons why there is increased hyperpigmentation in the postoperative period. And then surgery is an inflammatory response, and as an inflammatory response to surgery, melanocytes can be stimulated that can again activate melanin production. It is important also to note here that individuals with Fitzpatrick skin types 4, 5, which have a more darker tone, which already have a baseline increase of melanin, they have got a more propensity, more tendency to get more hyperpigmented in the postoperative period. So I think these were some of the reasons as to why skin grafts tend to hyperpigment. That is why it is very important for us to avoid, or rather to advise the patients to avoid sun exposure or use some protective garments while going out in the sun.